Welcome to the 12th episode of MoveMint Medicine. Thank you again for joining us. We hope that you've all found the episodes previously enlightening and that you've all taken some action from the advice that's been given. So firstly, just like to thank our partners. So it's the Fit India movement. So thanks for your support. Back to Fitness Clinic, which is the clinic that Rajat runs. La Ultra the High, which is the race that he puts together. And Moving Mountains Within, which is the film about the 10th edition of La Ultra the High. So I'll hand over to Rajat, who will introduce our guest.
Hello everyone, welcome to the 12th edition or 12th episode of MoveMint Medicine. And today we have Dr. Meenakshi Hariharan and a special guest because she is just appropriate, very apt for what's going on right now, coronavirus and stuff. So she's the microbiologist, the first one that we've had on this series. So Meenakshi, welcome. And could you just introduce yourself, please? So just telling about your academic, your professional background, your journey so far.
Yeah. First of all, I'd like to thank Dr. Rajat and Dr. Darren for inviting me and giving me the opportunity to share my fitness journey with everyone. So I'm Dr. Meenakshi Hariharan, a doctor by profession, but a fitness enthusiast. And I have done my MBBS and MD in medical microbiology from Guwahati Medical College. And after that, I have joined Downtown Hospital Guwahati as a consultant medical microbiologist cum infection control officer. If I start with the fitness journey, let me tell you that I was a very inactive person from my very childhood. Then I was not into any kind of sports or any kind of fitness program. And maybe because of that, from a very young age, I had a lot of medical issues. I was an asthma patient for a very long time. With frequent exacerbations, and I was on inhalers and then oral medications for that, and because of that my lung capacity was very low. I used to get tired very easily, forget about running and all. I used to feel tired even while walking for a very long distance or going up and down a stairs like that. And then after that, again in 2010, I had acute onset of severe neck pain, and I was diagnosed as cervical disc prolapse, with which I was also having nerve compression, for which I had weakness in my left limb, left hand, and then my motor power was 2/5, for which I also had to undergo emergency surgery. And even after the surgery also, the pain was still there. It took me a long time to regain the strength, power to do the normal activities also. And then I was on medications like gabapentin, pregabalin, which are the neuroprotective drugs. And then I used to take muscle relaxants very frequently because of the neck stiffness and all. And again in 2012, I had lumbar disc prolapse, for which again I had severe backache and back stiffness and all. So my life was full of pain, you can say. Then in 2015, I met my coach, Nishanta Bodole. He is the strength and conditioning coach of Indian cricket team, and he is also a visiting faculty of National Cricket Academy, Bangalore. So he has a center here in Guwahati, Studio Fitness, where I started my rehabilitation program under his strict supervision. So there he used to train me like he used to for muscle strengthening, then coordination, then balancing, then movement patterns, then neural adaptation, everything. Then after almost 6 months of rehabilitation, he started my functional training, where I used to do the exercises which helps the body to adapt to the movements, to do the regular activities, which really helped me to do the real life movements more efficiently and preventing injuries. So I used to do the CrossFit, I used to do weight training, strength training, then I used to do endurance based training, then outdoor trainings where I used to go for uphill run, and then long distance run, then sprints, everything. And actually that was the turning point of my life, you can say. That was the point where I realized that why functional fitness is so important for us, and that was the beginning of my fitness journey. And from then actually it's been now more than 4 years that I have been continuing the same.
Great, thank
Thanks,
you for
Meenakshi.
sharing that with us. It sounds like an incredible journey. I just wonder whether you could touch on sort of at what point you started to see some real improvements in terms of your pain and function. You know, did you see it within a matter of days, weeks? Did it take months?
Yeah, it took me around 3-4 months. I could see that I could slowly wean off the medications. My neck stiffness was less. I could feel the strength. Then, actually, before that, even the daily movements like the forward bending, forget about lifting a bucket full of water or something like that. Even walking for a long distance, uh, that was very difficult for me. But then after starting the rehabilitation for almost after 3-4 months, that I could do, I have started that, I have felt that I could do those things at ease. Then my endurance level was increasing. Then my frequency of taking medicines decreased. Then for the asthma also, my breathing issues that decreased significantly. I could run for a long time. Then those were the changes I could see after 3-4 months. And after 6 months, I started my weight training and everything. And earlier, overhead exercises, overhead weight trainings were simply just was a dream for me. But then after the rehabilitation exercises, I could almost do everything. It was not that I have started with scale down exercises, then I have scaled my exercises accordingly. But my coach, he made me do whatever he made me do. I used to do that sincerely. I have never done that means half-heartedly, and I could feel the change.
Meenakshi, but isn't it interesting, you being the doctor, and I'm talking as a doctor here,
Yeah.
it had to be someone else to show you what exercises to do, and how to get it better. You're the one who's supposed to get other people better. So what do you say about
See,
that?
see, we know the medicines. We know what are the operations we can do to get rid of those issues. But yeah, I never realized that a fitness coach or a fitness guru can guide me to have the strength, or to, I have never realized that actually. But after I met him, I could make out that yeah, fitness is more important than just taking a medicine or just going for an operation. Maybe if I would have met him earlier, then maybe the situation would not have arisen also to go for an operation or like that. Or maybe my asthma problem would have subsided much earlier than that.
Great. Thank you for that.
So what about your colleagues then? Are they active? Are they inactive? And have you been able to sort of promote exercise to get them active as well?
Many of them are marathon runners, then many of them do yoga, Zumba and all. But I don't know why they are not very open to weight training and CrossFit. They have a concept that weight training can lead to injuries. Then CrossFit are high intensity workouts, so there are chances of injuries. But I always tell them that, see, you have the chances of injuries if you are also going for a long distance run. If you have chances of injury, even if you are doing yoga with wrong technique. Okay, so but I don't know why they are not very open to weight training and all. but I always try to convince them. In fact, I have convinced few of them also to join a gym and to start CrossFit or weight training like that. Because functional training is something that helps your body to adapt to the movements what you do daily. Running is okay. In fact, running is included in CrossFit. When you add everything as a whole, it becomes a fitness program. Just doing one thing and you don't do the other, that doesn't complete the whole thing.
Brilliant. And that's awesome, Meenakshi. So, when people ask me about how dangerous is something, I usually tell them that you were born, you're going to die, right?
Yeah.
I mean, so this thing about, strength training will cause an injury, I think that's courtesy. Us doctors are not taught enough about the muscle. Maybe we knew which direction it goes in attachment insertion. We weren't taught the basics of a muscle. That's the problem.
Yeah,
But
and what I feel is that if you are doing weight training or the muscle training, then there, if you are doing it in a proper technique, if you are under the strict supervision, if you not lifting like just to satisfy your ego, if you are doing it with a proper weight, then it has much more benefit than any other fitness program.
yeah,
It
totally.
helps.
And can I just take it even further?
Yeah.
Shouldn't the medical curriculum, the way we were taught, it's interesting that you have to go to a gym to get better, right? I mean, a guy without any MBBS degree had to train us and teach us what the human body is about. I mean, come on, how ironical, right? We are the people who have 5.5 year degree and more, right? Uh, so shouldn't that curriculum be changing a little bit so we can make a bigger difference in the society?
See, actually, I think at our time it was not there. It was not included in the MBBS curriculum. But I think in 2012 or like that, MCI has given some guidelines to add yoga and exercises and sports in the MBBS curriculum,
Okay.
especially for the MBBS first year and second year. But I don't know whether it is really has been added or not, but then it has come up, and
So the
in
idea is
our
there.
time, yeah, it is there.
Mm.
So moving on then to sort of the general prescription of the public, you touched on sort of the importance of different elements of fitness, so cardiovascular fitness, strength, mobility, coordination. Could you just expand on that a little bit further to sort of suggest what is important for the general public?
See, starting a fitness program is the best thing you can do to your health. Nowadays we get lot of cases even in the younger age group with coronary artery diseases, with altered lipid profiles, and we get lot of cases with PCODs, hormonal imbalances in young age groups. Then we get lot of cases with early onset osteoarthritis, then hypertension, then diabetes. These are due to the sedentary lifestyle or the work for the it is, you can say these are the negative effects of working or sitting at a one place for a long time. Okay, so when you start a fitness program, it not only takes care of your mental and physical health, but it has many other advantages also. Like, first of all, it can manage your obesity, which is very common nowadays due to the junk food and the sugary beverages and all, due to the lifestyle. Uh, so it can be taken care of. Secondly, doing some fitness programs, especially weight training, all those things, that also reduces the chances of age-related degenerative changes. Then it takes care of the hormones, it takes care of the hormonal imbalances, you can say. Then it also takes care of the reduces the chances of chronic diseases and like diabetes and hypertension. Then it takes care of the sleep cycle, it takes care of the overall health. So I think everyone should start fitness or go for a fitness program. And above that, it gives you a confidence. When you look good, you feel good, it gives a confidence to present yourself to the world. You can be more efficient at your workplace, you can look after your family better. So that's my whole idea of uh, starting a fitness program.
Okay, thank you.
Thanks, Meenakshi. Now coming to the microbiologist, Meenakshi. Okay, so in this COVID and coronavirus thing that's actually going on, please enlighten us in like what's going on, because there's a lot of misconceptions about it, right? So it'll be good to know from you, like what's going on, how big a deal is it, what stage is India in, all that stuff.
See, coronavirus infection is not a new thing for us. Okay, like the other flu viruses like rhinovirus, human influenza virus, everyone is aware of coronavirus. And because we suffer from seasonal flu, so we have immunity in our body to those viruses, which not only gives cross protection to the other viruses which are common, and it also helps you to recover without any specific treatment, or it helps you to recover faster. But what happened here in the novel coronavirus infection, because this is a new strain, this is a mutated strain which has come from maybe some animal or human to animal contact, we don't have the immunity against that virus. And as a result, and because the transmission rate is also very high of novel coronavirus, that's why it is spreading globally. And uh, now if we see, as the data suggests that of the total people suffering from COVID, the hospitalization rate is only 6%. That means the 94% of the people are having the infection, mild to moderate infection, which don't require any hospitalization, and many of them may have the infection and may have recovered also without realizing that they have COVID infection. But the few people, the elderly age group and those with the comorbid conditions like asthma, then COPD, then diabetes, hypertension, then cancer patients who have somehow compromised their immunity, or maybe their lung function is not good, so they have landed up with severe infection and hospitalization. And let me tell you that out of those hospitalized patients also, the mortality rate is only 35 or 36%. And those who landed up on ventilators, there also the chances of survival and coming out of COVID is 50%. So if you see the total, then the percentage of the death rate is very low, it's only 2 to 3%. Okay, but why we are getting so much cases in USA and Italy is because the testing there is, they have done the mass testing, and which is not still done in India because these facilities are not available in all the centers in India. We don't have the facility of doing PCR. Only the designated labs in India can do this. And if we start doing the mass testing, then India can outnumber the cases in Italy or in any other places. And already India has reached the third stage, and it may be because the infection is spreading here rapidly because number of.
And third stages, just tell us about the stages, stage 1, 2, 3, what are they?
See, just if 1 or 2 cases are there, then we can consider it as the stage 1. If it is not going to the community, just person to person transmission, it is the stage 2. But here we are getting now the cases in community. there is a community spread, which is the third stage, and India has already reached that stage. Okay, now the numbers are increasing every day. If you see, it is increasing by 300, 400, like that. And it is because of the overcrowding, because the people are still, everyone is aware of the preventive measures, but no one is, many of them are reluctant, or many of them are not following those preventive measures. Even in the lockdown period, even when government has asked them not to go out of the houses, they like to visit their family members, or they like to go together for a dinner, even in the lockdown period, in some apartments and all, because they can't go out, so they will be doing parties and all in the apartments. So that are the places where you can come in contact with so many people. So this is a very crucial time. You have to know that if you are doing this, if you are behaving irresponsibly, that this is going to increase the number of COVID. Though the number of death rate is low, though we are really trying hard to control the infection, but if the people are not understanding it, if they are behaving irresponsibly, then maybe there will come a time when we all will get the infection. There is a chance, even like people like us who are visiting hospital every day, we are at the higher risk of getting infection. So if we don't behave responsibly, if we don't take the measures like social distancing, if we don't take the isolation measures at home, so there is a chance, if we have the good immunity, we can be a carrier and we can spread it to our family members. So we have to understand that, and we have to take the necessary measures. And the scientists are working on it. They are trying to find out the treatment, but right now we don't have any approved medication for it. We don't have any vaccines or antidote for it. So the only thing how we can prevent the infection is by taking the measures like wearing masks and hand washing, which is the most important. In fact, if you are wearing a mask, you should know how you are wearing it and how you disposing it. You cannot dispose it just like that. You have to take the special measures to dispose it, because that can be a source of infection. So you have to do the hand washing. You have to teach your children at home that what they mean, what is the meaning of social distancing, how you have to wash your hands, what are the steps of hand washing which we follow, then what is the benefit of using sanitizer. Everything you have to, people, they have to be aware and they have to follow it. And let's hope for the best that we get some remedy soon to control, or at maybe one point of time everyone will get the infection, and depending upon our immunity we will recover. So that's it.
So thank you. You've given some great advice there as to sort of how we can sort of mitigate the effects of this virus through social distancing, through staying at home during the lockdown. Is there any other advice that you'd give to sort of maintain health during this period?
See, this is a very crucial period for all of us. We have to take care of our health also, because that will help us to build up the immunity, that will help us even if we get the infection to fight against COVID-19. Okay, so we have to take care of our both mental and physical health. Then we have to take a healthy nutritious diet. Then we have to stay active. Even if we stay at home, it is not that we'll just sleep, we'll watch TV, we'll just have a very lazy lifestyle. It is not that. You have to exercise regularly at home also. You have to, whatever you can do. If you can do yoga, dance, Zumba, or exercise regularly. There are a lot of videos in YouTube everywhere where you can get the home workout videos. So you can follow them, do the workouts, or do the household activities, do cleaning, do gardening, whatever is possible for you. Climb up and down the stairs, but walk as much as possible the whole day, but then keep on doing something. And then I also like to say that avoid smoking in this period, because see, it has been proved scientifically that smoking increases the ACA2 inhibitors in the lung cells, which are the entry gates for COVID-19. So smoking can be significant, very significant, if you are for getting the infection, a significant cause for getting the infection. And if you are smoking, your lung function also deteriorates, and which can even affect the recovery of the patient. And that's why the fitness, to stay fit at this moment, is very important.
Super, Meenakshi. That's actually very useful. Just taking it further, because what's been spoken about by people like me and Darren for for a long time in exercise medicine, that exercise medicine is very important for non-communicable diseases, right? But what about infections? What about communicable diseases other than COVID? Uh, how important is it?
See, exercise helps to build up the good immune system. Okay, it boosts your immune system. So, I'm a microbiologist. I deal with millions of bacteria, fungus, everything in my lab. Okay, so if I don't have a good immune system, then I will get infection every day, and those will be multi-drug resistant because I am dealing with the hospital strains. So it will not be possible for me to continue the duty. So I believe that I have a good immune system because I exercise regularly, I take a healthy diet. So that really helps. But here I'd like to say a few things to the gym goers, especially that whenever you go to the gym, see, this is the best place to transmit any disease. Whether it's a bacteria, it's a fungus, or any viruses, even it has been scientifically proved that COVID-19 gym is one of the hotspots for transmission of COVID-19. Okay, so let me tell you why. Because you have the sweaty bodies and you have a warm, wet environment, and there is skin to surface contact in the gym. So that's the best place where you can get the infection. Even if you get fitness, it will not be of useful any use if you get those kind of skin infection or respiratory infection also. Okay, so when you are going to gym, it is for your own benefit and for the benefit of the others. I would like to advise few things, that always carry a pair of shoe which you use only in the gym, not anywhere outside. Then secondly, you should wear those quick dry t-shirts and quick dry clothes which don't which helps to dry quickly, don't can dry quickly. Then you should take your individual towels and water bottles. You should not share all those things with anyone else. And then mats, you should have individual mats. Then another thing is that please wash your hands immediately after workout. Please don't wipe your face without washing your hands, because that may be a source of infection. Then it is a source of infection actually. And then you should take bath as soon as possible after going to the gym, after completing the workout. And then the most important thing, which is also important for infections like COVID-19 and all, please don't forget to wipe off the equipments after use. Okay, because these are the equipments which where you leave the microbes after you use it. So if you don't clean it with a disinfectant, then what will happen, those microbes will stay there and they will transmit to the other people who are using it. Okay, so it is your duty to clean or wipe off the equipments after use. It is not anyone else's duty. So please take care of yourself. It is all about sharing and caring. To stay fit, it is for yourself, it is for others.
Brilliant.
Okay, thank you. That's some really important advice during this coronavirus period. So thank you very much, Meenakshi, for joining us today.
Thank you.
And
Thank you,
thanks to everyone.
Meenakshi.
Thank you
And
so
thank
much.
you to everyone who's listening. And please, if you do have any questions for us, add a comment in the comment section below the video when it appears on YouTube, and we'll try and reply to the comments there, or we'll actually answer the questions in the future podcasts. So thank you, Meenakshi, and thank you, Rajat, and we'll join you next time.
Thank you, guys. Take care.